Hello everyone, welcome to Wild Rose Nursing Classes. Today's topic of discussion is next generation NCLEX RN. So I'll try to explain things in Punjabi too. ਅੱਜ ਦੀ ਆਪਣੀ ਇਹ ਵੀਡੀਓ ਉਹਨਾਂ ਕੈਂਡੀਡੇਟਸ ਜਾਂ ਨਰਸਿੰਗ ਸਟੂਡੈਂਟਸ ਵਾਸਤੇ ਆ ਜਿਹੜੇ ਨੈਕਸਟ ਜਨਰੇਸ਼ਨ NCLEX RN ਦੀਆਂ ਚੇਂਜਸ ਬਾਰੇ ਜਾਣਨਾ ਚਾਹੁੰਦੇ ਆ. Before we proceed further with the topic of discussion, let's take a look at the requirements that you need to be a nurse abroad. So, of course, the nursing degree or diploma, then you need to apply to the Board of Nursing, get the eligibility, pass the license examination, and fulfill their other requirements to work as a nurse in the specific country. So all of you have heard about NCLEX, REX-PN, CPNRE. So what are these? NCLEX is National Council Licensure Examination for Registered Nurses for US, Canada and Australia. ਜਿਹੜਾ NCLEX ਆ ਉਹ registered nurses ਵਾਸਤੇ ਹੁੰਦਾ ਹੈ ਉਹ exam for US, Canada and Australia. REX-PN ਜਾਂ CPNRE ਕੀ ਹੈ? Canadian Practical Nurse Registration Exam ਆ. REX-PN BC ਤੇ Ontario ਵਾਸਤੇ ਆ. CPNRE is for the other Canadian provinces. NCLEX and REX-PN, they both are conducted by NCSBN. Now, if we talk about NCLEX and REX-PN, it's delivered by CAT. So CAT ki hai? It's computer adaptive test. So it is able to produce more stable results because it will target your ability to answer the questions, and then it will reassess your ability and it will change the level of difficulty accordingly. Now, what is next generation NCLEX RN? It's the newer version of NCLEX RN. It is it has been in effect from April 1st, 2023. And it requires you to demonstrate the higher level of clinical judgment in order to deliver the patient care. So these are the few changes as per NCSBN. Duration of exam is still 5 hours. Total number of questions are changed. So now minimum are 85 and max are 150. Scored items are 70 and to 135, and unscored are 15. So you will never know about which questions are unscored or which are the pre-test questions. So that usually you will get all these 15 unscored or pre-test items in the first 85 questions. The biggest changes, the unfolding case studies. There will be maximum to 3 of the case studies, and each case study will have 6 questions related to that, and standalone questions will be 52 to 117. So what are the standalone questions? Actually, they are the questions that which have the short scenario about the patient, and the one question will be related to that. And about the unfolding case studies, this case there will be a case study that will unfold the different phases of patient's life or the scenario, and then you will get the 6 questions related to that. There can be maximum of 3 case studies in the newer version of NCLEX RN. And then this is the most important change. The new NGN items will not be scored as either correct or incorrect. Instead, this new scoring model will allow for the partial credit for most of the items. Now, what that means? Suppose earlier we used to get select all that apply questions, SATA questions. ਉਹਨਾਂ ਦੇ ਵਿੱਚ ਕੀ ਹੁੰਦਾ ਸੀ, ਜੇ ਤੁਸੀਂ ਇੱਕ option ਗਲਤ ਟਿਕ ਕੀਤੀ ਆ ਤਾਂ your question is wrong. But in this case, ਜੇ ਤੁਹਾਡਾ partial ਜਿਨ੍ਹਾਂ ਦੇ ਬਾਰੇ ਚ ਤੁਸੀਂ short ਹੋ ਉਹ ਸਾਰਾ ਕੁਝ ਤੁਸੀਂ ਮਾਰਕ ਕੀਤਾ ਤਾਂ ਤੁਹਾਨੂੰ ਉਹਦਾ ਜਿਹੜਾ partial credit ਆ ਉਹ ਮਿਲੂਗਾ. Now let's talk about the scoring. So ਜਿਹੜਾ pass ਜਾਂ fail ਹੁੰਦਾ ਆ NCLEX RN ਦੇ ਵਿੱਚ ਉਹ ਕਿਵੇਂ decide ਹੁੰਦਾ? There are 3 things that will decide about this thing. The 95% confidence interval rule, the maximum length of the exam, route or run out of time. So the computer stops administering the questions when it is 95% certain that candidate's ability is clearly below or above the passing standards. ਸੋ ਜਿਵੇਂ ਸਾਰੇ ਕਹਿ ਦਿੰਦੇ ਆ ਕਿ ਮੇਰਾ ਇੰਨੇ ਕੁਐਸਚਨਸ ਦੇ ਉੱਤੇ ਕੰਪਿਊਟਰ ਬੰਦ ਹੋ ਗਿਆ ਸੀਗਾ। ਸੋ ਉਹਨੇ ਕੁਐਸਚਨਸ ਦੇ ਵਿੱਚ ਜਦੋਂ ਕੰਪਿਊਟਰ 95% ਸ਼ੋਰ ਹੁੰਦਾ ਆ ਕੈਂਡੀਡੇਟ ਦੀ ਐਬਿਲਿਟੀ ਬਾਰੇ, ਤਾਂ ਇਟ ਵਿਲ ਸਟਾਪ delivering the questions. Maximum length, when the candidate's ability is very close to passing standards and the computer will keep administering the questions. Run out of the time. If the candidate runs out of the time without attempting the minimum number of questions, the result will be fail. If the candidate has answered the minimum number of questions, then the computer decides the final ability estimate computed from the responses to all the completed items. Run out of time ਦੇ ਵਿੱਚ ਕੀ ਹੈ, ਜਾਂ ਤਾਂ ਕਿ ਤੁਸੀਂ minimum question attempt ਹੀ ਨਹੀਂ ਕਰ ਪਾਏ 85, ਤਾਂ result will be fail, ਜਾਂ ਫਿਰ ਤੁਸੀਂ minimum ਜਿਹੜੇ 85 questions ਆ ਉਹ attempt ਕੀਤੇ ਆ ਐਂਡ ਉਹਨਾਂ ਦੇ answers ਦੇ basis ਤੇ ਕੰਪਿਊਟਰ ਤੁਹਾਡੀ ਜਿਹੜੀ ability ਆ ਉਹਨੂੰ estimate ਕਰੂਗਾ ਤੇ ਤੁਹਾਨੂੰ ਉਹਦਾ result ਦਊਗਾ। And all this information is also available on NCSBN's website, National Council of State Board of Nursing. And this video has been made with special thanks to NCSBN. Thank you and have a nice day.